hormones are your vitality engine, so they are going to drive your vital energy. So I look at it from a couple of different standpoints. Number one, I'm always thinking in Western medical terms, so I'm thinking about the hormone dance that goes on every month, female-wise. And at the same time, I'm using the TCM, traditional Chinese medicine model, and looking at it from that perspective. So when it all goes well, it's a beautiful dance. It looks great. But when it doesn't, there are a lot of working pieces, and having a lot of different tools and ways to look at it really helps to try and diagnose and create some sort of a protocol for change to bring balance back to the system. So it's always about balance, no matter what we're dealing with. And so when a person comes in with a set of imbalances, it's just like balancing an equation. And I'm not a mathematics person, but that's an analogy I use. Once you balance to find all the variables and balance them, then we should, start to have some changes in the symptom patterns and the physiology. And if a variable changes, then maybe we're off balance again. The primary cause of disease would be emotions that overwhelm our system and stagnate our chi, our life force. And so the obvious, I call it obvious, but obvious things, physical, chemical, emotional stress can cause it. And as far as things that happen in the body that I've noticed over the years that are kind of silent in the background would be bile stagnation. So your liver produces bile, stores it in the gallbladder, you eat a fatty meal, and it squirts that bile into the small intestine. Well, from there, it acts like soap. It allows oil and water to mix, but it also has a lot of environmental toxins that you're getting rid of, and old hormones, especially estrogen. And so if the bile gets stagnant and you're not clearing estrogen, estrogen builds up in the system. So from my point of view, almost all hormonal issues in the body are almost the majority of female issues starts with what I call a simple hormone imbalance that could be driven by any number of factors or variables. And those are two that are some of the most common. Bile needs to be thin to be able to move. So I'll use products from Standard Process usually, beta food, AF beta food, or we can use herbs like globe artichoke. That does a great job. There are a lot of other approaches, to thin the bile and get it to move. So even when the gallbladder is removed, it doesn't fix the problem. So the bile is getting thick and sticky, and it's sitting in the gallbladder. If it's there long enough, it'll calcify, and you'll have stones. Someday it gets hot, you take it out, and it feels better because the rotten, bad tissue's gone. And but nothing changes as far as the bile. So the bile is still thick and sticky, and it's just sitting in your liver now because the little organ that usually stores it's no longer there. So we can still go back and start thinning the bile in the liver and getting it to move. So we can fix it or take the stress off of it at any time. It doesn't matter. So some patients have had their gallbladder out for years, and they don't really notice any. They just feel good, they're fine. And a lot of others, no, they still have gallbladder symptoms, and but they don't have a gallbladder, so it can't be that anymore, right? And that's where we go back in and look and see if we have stagnant bile, and just a real important base piece for the hormonal system.